Why your feet get cold. Fix lazy pipes and improve circulation. Why are your feet cold, even when the room isn't? Have you ever been sitting comfortably, maybe watching television, wrapped in a blanket, and your feet still feel like ice? You wiggle your toes, you rub them together. Maybe you put on thicker socks, and yet they stay cold. Is that just getting older? Is something wrong with your circulation? Or is your body simply doing something you don't understand? In the next few minutes, I'm going to explain calmly and clearly why your feet get cold, what is actually happening inside your blood vessels, and what you can do to improve circulation safely. No fear, no complicated medical language, just practical science you can use. Because here's the part most people miss. Cold feet are often not a damage problem. They are a response problem. Let me explain this simple fact. As we age, our circulation does not suddenly fail. What changes is responsiveness. Your blood vessels are not rigid pipes. They are living tissue. They expand, they narrow, they adjust constantly. This adjustment system is controlled by your nervous system and your blood vessel lining, called the endothelium. When you feel cold, your brain makes a decision. It protects your core, your heart, lungs, and brain by sending less blood to your hands and feet. This process is called vasoconstriction. It simply means narrowing. Now here's what changes with age. Blood vessels can become less flexible. The signaling between your brain and your vessels can slow down. Muscle mass in the legs decreases. Activity levels often decline, and all of that affects how quickly warm blood reaches your toes. It is not that your body is broken, it is that your system has become less efficient. Think about a garden hose that hasn't been used much. Water still flows, but the pressure may not be strong. That is what often happens with circulation in the lower legs. Another everyday example. Have you noticed that when you walk for 10 minutes, your feet warm up? That tells you something important. The blood is capable of getting there. It just needs stimulation. This matters more than you think, because when circulation improves, comfort improves, balance improves, and overall vascular health improves. Cold feet are often a signal of underuse, not disease. Let's talk about what most people believe. Many assume cold feet mean blocked arteries. That is not usually the case. True arterial blockage typically comes with other symptoms: pain when walking, slow healing wounds, significant color changes, one leg colder than the other. Most people with simple cold feet do not have those signs. Another misunderstanding is this: if I just wear thicker socks, I'll fix it. Socks make you feel warmer, but they do not train your circulation. They insulate, they do not stimulate. There is nothing wrong with wearing socks for comfort. But if insulation replaces movement and circulation training, your blood vessels never practice expanding. Here's the part most people miss. Circulation improves with gentle challenge, not with constant protection. And that does not mean extreme cold exposure. It means consistent, safe stimulation. Let's go through what actually works. Section 1. Gentle temperature contrast. Clear idea. Mild temperature changes train your blood vessels. Why it works. When your feet are exposed to mild cool water, blood vessels briefly narrow. When you step out, they reopen and warm blood flows back. This repeated opening and closing improves vascular responsiveness over time. It is similar to stretching a muscle. Practical action. At the end of a warm shower, run cool, not freezing, water over your feet for 20 to 30 seconds. Then dry thoroughly and warm naturally. Do this once daily. Who should be careful? Anyone with advanced diabetes, severe neuropathy, or known vascular disease should consult their healthcare provider first. When results are noticed, most people report improved warming response within a few weeks of consistency. Soft question: have you ever noticed how your feet warm quickly after a short walk? The same principle applies here. Section 2. Walking, the natural circulation booster. Clear idea: your calf muscles are a second pump. Why it works. When you walk, your calf muscles squeeze veins and help push blood back toward the heart. This improves overall flow and reduces pooling in the lower legs. Even 10 to 15 minutes makes a difference. Practical action. Walk daily at a comfortable pace, indoors or outdoors. Supportive shoes. Good posture. If balance is a concern, walk near a wall or with a companion. Who should be careful? If you experience leg pain with walking that stops with rest, consult a professional before increasing activity. When results are noticed, warmth often improves immediately after walking. Long-term improvements come with regular habit. This matters more than you think. Movement is circulation medicine. Section 3. Foot and toe strengthening. Clear idea. Stronger foot muscles support microcirculation. Why it works. Small muscles in your feet assist blood movement. Weak muscles reduce efficiency. Practical action. Place a towel on the floor. Use your toes to scrunch it towards you. Repeat 10 times per foot. Or practice slow heel raises while holding a chair for support. Who should be careful? If you have balance issues, always hold stable support. When results are noticed, within weeks, many notice better foot warmth and less stiffness. Let me explain this simply. If muscles move, blood moves. Section 4. Nitric oxide in food. Clear idea. Certain vegetables support vessel relaxation. Why it works. Leafy greens and beets contain natural nitrates. Your body converts these into nitric oxide, which helps blood vessels relax. Practical action. Include foods like spinach, arugula, beets, and pomegranate in meals several times per week. No supplements needed unless advised by a professional. Who should be careful? Those on specific medications affecting blood pressure should consult their provider before large dietary changes. When results are noticed, diet supports long-term vascular health rather than immediate warming. Consistency is key. Section 5. Hydration. Clear idea. Dehydration thickens blood slightly. Why it works. When fluid intake is low, circulation efficiency drops. Practical action. Drink water regularly throughout the day, small amounts consistently. Who should be careful? Those on fluid restrictions should follow medical advice. When results are noticed, energy and warmth often improve gradually. Simple, overlooked, powerful. Section 6. Sleep and stress regulation. Clear idea. Stress tightens vessels. Why it works. When stress hormones rise, blood vessels constrict. Poor sleep increases this effect. Practical action. Create a wind-down routine. Dim lights. Avoid late heavy meals. Practice slow breathing before bed. Who should be careful? If insomnia is severe, seek guidance. When results are noticed, improved sleep often improves cold sensitivity over time. How does this fit into daily life? Morning, light stretching, hydrate, short walk if possible. Midday, balanced meals with vegetables. Avoid long periods of sitting, stand up every hour. Evening, gentle movement after dinner. Warm shower ending with brief, cool foot exposure. Sleep. Consistent bedtime, calm environment. Notice the theme? Nothing extreme, consistency over intensity. Small daily signals teach your body that circulation matters. These strategies are suitable for most healthy adults. However, consult your healthcare professional if you have severe diabetes, peripheral arterial disease, non-healing foot wounds, sudden one-sided coldness, significant color changes. If unsure, ask before beginning. It is always better to be cautious. Let's bring this together. Cold feet are often a circulation responsiveness issue, not a failure, not a flaw. Your blood vessels respond to movement, mild temperature shifts, nutrition, hydration, and rest. When you stimulate them gently and consistently, they adapt. That is how the body works. You do not need extreme measures. You need steady habits. Your circulation can improve at any age. That should feel reassuring. If this explanation helped you understand your body more clearly, consider subscribing for more simple, science-based health guidance. Share this with someone who always complains about cold feet. And if you'd like to continue learning, watch the next video on improving balance and lower leg strength. We are building health step by step, and I'm glad you're here.